There were more than 45,000 tests yesterday, and whilst it's slightly down, we know on weekends it tends to dip. So we're encouraged that so many people came to get tested on a weekend, and we encourage similar numbers today. Those high testing rates are so important in convincing us that we're not missing any chains of community transmission. To 8 p.m. last night, there were 16 cases of local transmission or community transmission. In 13 of those cases, the people were completely in isolation. One was in partial isolation and only 2 were infectious in the community. So we are seeing numbers go the right way, but I do say cautiously that that could still bounce around. And we've seen in the last few days how easy it is for people to unintentionally do the wrong thing or intentionally do the wrong thing, and that can result in more cases, which is something we don't want to see. Dr. Chant will, of course, provide her update, but what we are seeing is that the transmission now occurring in households or within households. So we say to everybody, stay at home means stay at home. Only leave the house for exercise, only leave the house when you absolutely have to, and please don't go visiting each other because that's how the virus spreads. If people do the right thing, we have a greater chance of getting out of this in a timely manner. And whilst the numbers overnight are very encouraging compared to the previous day, we know that they still have a potential to bounce around. And we still know that the next few days are absolutely critical. The New South Wales government will be looking at, obviously, the health advice, but also that advice will depend on what the cases and the days of transmission or exposure in the community look like in the coming days. So whilst the results overnight are very pleasing, there's no doubt the impact of the lockdown has been evidenced. However, to keep that trend going, we need to make sure people don't give in and don't break those rules we've put in place. They're there for a reason. And yes, it's great, sunny outdoors. We'd much prefer you to go outdoors in a COVID-safe way than go to those riskier indoor settings. But just be responsible and make sure that you don't leave the house unless you absolutely have to, especially when you're visiting indoor settings. And also make sure that when you are exercising, you're keeping a good social distance in a safe way from everybody else. So I'll ask Dr. Chant to give her update. Then Deputy Commissioner Warboys will give an update. Compliance is really important the next few days. It really stresses me out when we hear examples of businesses not doing the right thing, of individuals not wearing masks when they need to, because when people don't do the right thing, even if it's just a handful, it impacts all of us. And we don't want to see that jeopardise the good work we've been doing to date. So Deputy Commissioner Warboys will talk about those compliance issues, and now I'll ask Dr. Kerry Chant to give her update.
Thank you, Premier. So New South Wales recorded 16 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. 14 of those were linked to previously confirmed cases, and 5 of these linked as being household contacts. No new cases were acquired overseas in the 24 hours to 8 p.m. last night. As the Premier said, it's pleasing to see those high rates of testing, 45,079 tests, but we need to see it sustained, those levels sustained for the coming days. In terms of the new cases, 13 were in isolation throughout their infectious period, and this is what we're really going to have an eye to. If we do see cases occurring but people are in isolation, then they pose no risk of generating further cases in the community. 1 case was in isolation for part of their infectious period, and 2 cases were infectious in the community. For those that are close contacts who have been told you are a contact of a case, isolation means removing yourself from all others unless you are all co-exposed and are, because you're an adult caring for a child, isolating together as a group. Isolation means not leaving your house unless you need urgent medical care. And even then, you should be ringing ahead and taking the precautions outlined. So there is a distinction between isolation and the stay-at-home directions. The stay-at-home directions, again, we're asking you to minimise your exposures. You are permitted to get essential goods and services, but for the remainder of the time, stay as very much at home. You are permitted to exercise. And can I just again stress the fact that outdoors is less risky. So rather than being tempted to have some people over or neighbours over or friends over into the house, enjoy the outdoors, walk around the block, I understand parents with young children and it's pleasing to see them riding bikes and everything outdoors, but keep away from others. We don't want any crossover between households. That we have 3 new cases, again associated with Great Ocean Foods, and again we've seen this as a very significant spreading event. So again, anyone who's still in that close contact and associated with that, please continue to follow the health advice. Whilst we do see cases most likely arise in the first 7 days, cases when you've been exposed at a certain point can even arise up to those 14 days afterwards. So still, please continue to get tested, and we do recommend everyone on their exit from isolation does get a test at that day 13, 12, 13 or 14 mark to give us that absolute assurance. In today's numbers, we also have 3 individuals associated with the Summit Care Balcombe Hills aged care facility. As you recall, we did have some healthcare workers at that facility that tested positive and were infectious at that facility. That facility is in lockdown, and there's been a program of testing, repeated testing of all the staff and the patients. Late last night, that came back to indicate that 3 of the people at that facility, residents of that facility, a woman in her 80s, a man in his 80s and a man in his 90s. Now, pleasingly, those 3 individuals were fully vaccinated. But out of the abundance of caution, they've been offered transfer to Westmead Hospital for observation, and to date, no further residents have tested positive. But there will be continual cycles of testing in both our healthcare settings and these aged care facilities, and that will need to occur for 14 days since their last exposure to the infectious person before we really understand the full impact in those settings.